do, if you've made your occlusal rims quite thick, before you start setting up the teeth, you might want to reduce the size of them, the bulk, the thickness, and that's what I've done here. As you can see, these occlusal rims are quite thin, and hopefully they're placed directly over the alveolar ridge, and I think if they're not too thick, it's going to be easier to place the teeth. What you should also do with the college block on, draw a pencil line on your table, and this will give you an indication of the position of the teeth as well. And you should have marked your centre line so you know where you're going to start. So what we're going to do is start with the upper anteriors, setting them to the table first. So in the usual manner, heat up the wax. Take the first central incisor, place it roughly in position, close the articulator, make sure the pin is on the table and that the incisal edge of your central incisor is completely touching the table. It shouldn't be lifted up in the distal corner, and that the neck of the tooth is slightly in. Then the lateral incisor, and how should the lateral incisor be positioned in relation to the central incisor? Somebody tell me?
Slightly.
It should be slightly higher than the central incisor, and how should the neck be? Tucked in a bit more, and yes, and at a bit more of an angle to the centre line. So that's not quite high enough because it's almost touching the table. You want it a half to 1 millimetre shorter or higher than the central incisor. So I'm just going to push that up a fraction and check it again. Okay, also check it this way so that they're starting to form a nice curve, and check it in relation to the pencil line. It's just as a guide, the pencil line on the table. Now the canine tooth, and how should that be positioned?
Same height as the central incisor.
Yeah. What about?
Are the roots slightly tilted?
Yes, neck out a little bit. And what about its inclination to the midline? Should be straight, that's correct. So that's our first 3 teeth. So it's just the tip of the canine that's touching on the table, but the key is that this pin remains on the table at all times. If this is lifted up even a tiny bit, that's going to be magnified in the mouth. It's going to be worse in the mouth and create a raised bite. So then you need to look at the teeth this way, and the easiest way is to put your finger there so you can see how they curve round, and the incisal edges of these teeth should start to begin a nice curved shape here, and the corner of the canine tooth should be tucked in slightly on this job. Oops. And then we're going to do the 3 teeth on the other side, and then you're going to do it. So again, so obviously on this job, the arch is fairly symmetrical, so we can make our setup nice and symmetrical. Now position the tooth roughly and then close the articulator, and then just tilt the tooth slightly and then check it this way. I can see I'm out of alignment slightly here. I need to push the distal corner out a little bit to give some symmetry, and then just change the position of the neck. so that's your central incisor, lateral incisor the same. Need to heat the wax a bit more.
How long are we meant to do that? Like for 1 hour?
Pardon?
How long?
The whole job should take you 2 hours, really, from
2
start,
hours.
including waxing up.
Upper and lower.
Yeah. And that includes and that includes balanced occlusion. We're going to make balanced occlusion in this one, which is a little bit more tricky than the one that you did previously. Lateral incisor. Check the arch here. And then the canine again. So when you look at it this way, you want to try to make sure that they're at the same level. So you've got symmetry at the front. Bring that down.
Okay, jump with the glasses as well for one of these molds. Shall I leave it there?
Oh, yeah. Okay. Right. Okay. Right, so that's what you need to go and do. Do you want to have a look at that? Pass it round. Okay, now we're going to start setting up the posterior teeth to the table. So heat up the wax in the normal way. Take your first premolar, put it into position, close the articulator, and then bring the tooth down so that both cusps touch the table and the pin remains on the table here. Do the same process with the second premolar. Once that's in position, we need to check the alignment over the alveolar ridge. So I need to just adjust these teeth slightly. They need to be in the centre of the alveolar ridge, like this, from the corner of the canine tooth here to the centre of the alveolar ridge. That's the easy part. We're now going to put in the upper first molar and start to introduce the compensating curves. Put the first molar into position, and then what you need to do is you need to lift up the distal part of the tooth and push the neck in slightly. So only the mesial palatal cusp is touching the table, which is this one here. So when you look at it from the side, the buccal cusp should be off the table and the mesial palatal cusp should be touching the table. This is the introduction of the anterior posterior compensating curve. Putting in the second molar, we don't want any of the cusps to touch the table. So put it in position. and just check it here. So you're getting a nice compensating curve. Just adjust this one slightly. These compensating curves will allow for anterior. The anterior posterior compensating curve will allow for the patient to have lateral movements without cuspal locking when they're using the denture. Setting up the lower teeth to the upper denture in this method, so the first thing you need to do is to put your lower first premolars into the correct interdigitation position for a class 1 denture, and then that gives you your restricted space for the anteriors. So you then mark your centre line and then start to set up the lower incisors. And the reason we're doing it like this is because if we start from the central incisor, we spend some time setting up the incisors and then find that we can't get the premolar in the right position, you know, you've wasted a lot of time. So if you put the premolars in first, and then you've got your restricted space for the 6 lower anterior teeth. What you may find are that these lower incisors, although they're quite small, they're a little bit too large for this job. So what we've had to do is just slightly trim just a little bit on either side at the top with a burr, and that just gives you a little bit of extra space to get them in the correct position. Now the canine. So I've got them roughly in position, and now I'm going to adjust them. I'm going to move them in slightly. So you want to maintain a nice arch shape here, following the anterior part of the alveolar ridge. Closing up any gaps between the teeth now, unless of course the patient requests gaps, and then you put gaps in. Gaps are called diastemas. Making sure you've got a reasonably equal distance of overjet here, and then working round to the other side. Once you've got the first 3 in, it's relatively easy to do the others. You've got less space on the patient's right side, so this is where we might find some difficulty in positioning the teeth without trimming them a bit more.
Is it just this patient, not others, or everyone is the same?
No, it varies from patient to patient. Everyone is unique. And I'm going to try and put the final tooth in now and see how that goes.
Did you already trim your tooth?
A little bit, yeah.
It's just on the lateral medial side of them.
Yeah. Okay, so that's that done. Have a go.
Okay, thank you.
Okay. Thanks. Right, so you need to, once you've got your premolars in, then you've put your incisors in, and you've done the same process as we did last week with that. what you're going to do now is just working on one side at a time and then moving the articulator just a little bit from side to side to see if you've got any cuspal locking. And if you have, see, this side's okay, but when I move it to the patient's, remember we're talking about the patient's right and left, so this is the patient's left and the patient's right, not my right and left. So when I move it to the patient's left, there's a little bit of lift off the table with the pin, and that means that I need to change the angle of the lower premolar. I'm not going to interfere with the upper premolars at the moment because they've already been set by. So that's better. So now I've just adjusted that tooth slightly. I can do a little bit of movement, 2 millimeters or so to the patient's left and a couple of millimeters to the patient's right. That means that that's going to be relatively stable in the mouth. So you need to do that now with every tooth that you put in. So when we put in the lower 6 now, the first molar, we do the same process. So put the lower first molar into position. Check it from the lingual side. Make sure you have close contact between the upper and lower teeth. And then stick it into place. Make sure you've got very close interdigitation of the teeth there, the correct interdigitation. And then again, patient's right lateral, that's fine. The pin is staying on the table, that's not coming off. That means the teeth are in the right position at the right angle. And of course you do that with the last tooth as well. So put the last molar into the correct interdigitation first. Stick it into place and then try your right and left lateral, and that's fine. Can you see now the compensating curve? When you look at the teeth together, they're running up towards the back. And by having the correct compensating curve, you'll be able to achieve lateral and protrusive movements without the dentures becoming unstable in the mouth. Okay, that's it. And then of course you do the same on the other side.